and I'll shift to the situation now. And if the direct killing is stopped, unfortunately, the indirect killing is still continuous. For example, before this genocide is starting, we have eight cath lab for cardiac catheterization. Now we have just only one, which is a very old one, very old-fashioned in European Gaza hospital. And unfortunately, even without consumables and without the very essential needs to do cath for them. So still now, there's some of the people, they are losing their lives while we are waiting. I'll just mentioning now the obstacles which we are just facing just right now after even the pause of the ceasefire. First of all, the supplies. I'm talking about the medicine. You know that there is the essential drug list, which is containing almost 500 items, while in the private markets, it's more than 5,000 items. And the 500 items, the zero stock of the medicine, 45% of the essential drug list at the zero stock, 40% of the consumables at zero stock. Again, the lab reagent, it's the same, and the spare parts is the same. That's number one. Number two, as I mentioned before, the pillars of the health system, which is called the socio-economical determinants or the health determinants. I'm talking about the safety of the water. You can imagine we collect some samples of the water, and although the amount of the water is so few and so limited, even that amount is not suitable to be used by a human being. And at that time, we collect. It's just one month ago, and it's the situation is still running at the same percentage, which is 30% of the samples which was collected, it was biologically contaminated. And that can explain nowadays the still running polio virus. You know that unfortunately we investigate for the polio virus after we did a campaign, and unfortunately it's still circulating as the sewage system is running between the people and there is no clear water to be used. I'm talking about the safety of the foods, while most of the foods were stuck at Rafah border, and now they start to enter some of the foods which is out of date and it's not suitable to be used. And unfortunately, even we are not, as the health system, not at Rafah border now to investigate the food and to decide if that food is safe or not safe. And again, as I mentioned, till now, we have no system after they destroy and destruct the devices of the management of the medical waste. Unfortunately, now we are not managing any of the medical waste, and we just push them around down to the street while some of the children are trying to collect something just to use for cooking or something like that. So,
Can you correct me, please, if I'm
yeah,
mistaken? I think that polio campaign was never completed in the north. They did not allow it to complete. They gave the first
partially.
dose, but did not allow the second one. So, I mean, that also explains why the polio is still going.
Yeah. You are right. Actually, there is many reasons. One, which is the malnutrition and the lack of the immunity. So they didn't get good immunity to that virus. And the second one, in spite of just doing the campaign at one time, Gaza was divided into three phases. And at the north, unfortunately, lots of obstacles were there, and we were unable to reach all the children. And the other one, which is the water and the sewage system. So many reasons. It's a multifactorial one. So this is the number two I'm talking about after the supplies. Number two, which is the public health destruction and public health determinants, which was totally distracted. Number three, I'm talking about the electricity, and still we are struggling without being able to the solar system and without being able to have some of the spare parts. And till now, they are not allowing anyone to bring some of the electrical generators, as they mentioned, it's a dual use. So unfortunately, we are unable even to run the hospital with a full capacity. Some of the hospitals, like Nasser, we are unable to run the hospital in a full capacity as there is no electrical generators enough to support all the departments. So we start to use part of the hospital while we are in a bad need for each room, for each bed, for each ICU beds. Unfortunately, we are unable to use all the hospital facility as the electrical support is not enough to support all the departments. Number four, actually, it's not only the electrical generators, the oxygen stations, unfortunately, they distract most of the oxygen stations, and we are struggling. This morning, I was at Shifa Hospital, at North Hospitals, and we are struggling there, and we are unable to run even some of the ICU beds as there is no oxygen source and there is no oxygen stations to support the ICU units inside the hospitals. And unfortunately, again, as they don't accept any electrical generators to enter to Gaza, again, they are not accepting any of the oxygen stations to enter to Gaza. And
I just, if I may please, I just heard that in the news about the oxygen, actually. North Gaza alone used to have 20 units or stations to produce medical oxygen. Out of the 20, there is only one now that is running at half capacity, and that is not, of course, not enough to provide enough oxygen for all the hospitals in the north. So most of the ICUs and the neonatal intensive care units are not functioning because there's no enough oxygen. Can you imagine? I mean, even the 20 stations were not enough before because of the siege, and now they are only limited to only one half functioning station, half capacity.
Yeah, we are not depending on the liquid oxygen. Our system is not depending on the liquid oxygen as it's need special arrangement, and we are depending on the oxygen concentrators and to produce the oxygen through that stations. And as you mentioned exactly, most of the hospital now we are trying after they distract. You know that at the north they distract Beit Hanun hospitals completely, which was mainly focusing on pediatric and other specialties, but mainly pediatric. And they distract Kamal Udwan, as you know, and they distract Nasser Hospital and Nasser Hospital completely. And they distract Ad-Durra Hospital. Now we start to reflex Ad-Durra Hospital, and we are trying our best to restart Arantisi Hospital, but unfortunately, we are unable to restart them completely as there is no oxygen source for the ICU and the neonatal ICU. Yeah, previously in Shifa Hospital, there were 24 operation rooms. Now there's only 2 operation rooms, and we are unable even to expand more. If we'll be able to expand more, we are not able to actually to expand. But if we'll be able to expand more, unfortunately, there is no oxygen for them, and there is no oxygen for the ICU, and the 55 neonatal ICU at Shifa Hospital, it's completely distracted. And we are trying now our best to shift some of the cases and some of the incubator to Arantisi Hospital. But again, the problem that we are unable to fully fix that unit as there is no oxygen. Actually, the number is more than one. We have one at Al Ahli Al Arabi, and we have another one at the Indonesian hospital. It's now pending to be restarted, but with a small capacity, and they are unable to cover all the needs. Even some of the people they are in need to have some oxygen cylinders for themselves out of the hospitals, and unfortunately now they are struggling and they are unable to manage. For example, the chronic obstructive lung diseases, all of them, they are depending on oxygen, and nowadays unfortunately they die in peace, as I mentioned, silently. without being able even to be supported with oxygen.
So it's not just dialysis patients who are dying. It's the COPD patients, the cardiac patients, all the cancer and oncology patients, all people who need all this intensive chronic care are dying because there's the complete lack of medical support and system. Thank you.
Yeah, exactly. Number four, which is the radiological devices. I'm talking about the CT scan and the C-arm. I'm talking about the X-ray, the basic X-ray. All of these machines were distracted. The vast majority of those machines were distracted, and unfortunately, they are not allowing any other machines to enter Gaza. For example, the C-arm, which is so necessary for the orthopedic surgeon. Unfortunately, all of the machines now, they are not functioning. And we have some of the machines, we pay for that machines, and they are now at the West Bank, but they refuse to give us a permission to enter, to bring some of that machine. The CT scan is the same. The cath lab cath is the same. The basic X-ray is the same. So even the other machines,
Sorry, what's their excuse? What's their excuse of not allowing a medical machine, an X-ray or a CT scan or a C-arm or an MRI to get in?
actually they are not washed to tell us about an excuse for that. Actually, it's just rejected. And whenever we put more pressure, they will tell us that for the security reason. I don't know how they can use, for example, MRI. We have MRI through JICA. Now we have MRI at the West Bank, and we are unable to bring them as they refuse to bring them for more than one, even for more than 1 year, even before the genocide. And now it's more than 2 years while we are waiting for that MRI at the West Bank. At the same situation is applied when I'm talking about the cardiac authorization and the C-arm and the other machines. Again, the number five, when I'm talking about the critical medicine, the emergency department and the theater and the ICU and the neonatal ICU. Unfortunately, almost all the emergency departments now is distracted. Now we're trying our best just to restart the emergency department at Shifa Hospital in the only area which can be used for that, which is the outpatient department. Actually, they completely distract Shifa Hospital, which was containing 700 beds at that time. And the emergency department was able to engulf and to manage 100 cases at one time. It was the biggest emergency department. Unfortunately, it's completely distracted, and now we are trying our best just to manage some of the cases like trauma stabilization point in the outpatient department, as there is no longer emergency department. So I'm talking about the critical medicine. Number five, which is the ambulance system. And again, they distract most of the ambulance system, and they are not allowing to bring the batteries. You know that now for more than 1.5 years, most of the ambulances, now the batteries are not functioning, and it's not allowed. You are not allowed to bring any batteries from outside. And even ايش معنات الاطار اطار السيارة الكاوشوك.
The wheels, yeah.
The wheels after all of this duration, all of the wheels now, they are not suitable to be used, and even the wheels is not allowed to come inside Gaza.
So
And
they are
now,
not even allowing wheels for the ambulance.
The
The few
tires.
yeah,
ambulances left there.
yeah,
Tires,
exactly.
yes.
Tires,
Yeah,
Tires, sorry, the
yeah,
tires.
the tires. Yeah, the
Sorry.
tires, exactly. And the number seven, I can refer to the human resource, as some of them were killed, more than 1,000, 100 are detained, and some now they are out of Gaza, and the remaining, unfortunately, some of them now they are planning to leave. And we face, really, we face regarding the human resource at that time, during this escalation, during this genocide, we face a plan at that time and hidden agenda just to completely distract the health system and to have a parallel system And we were always facing the very difficult decisions, like for example, the field hospital. You can imagine that one organization, they brought a field hospital, just the skeleton of the field hospital, without any equipment, without any devices, and without any staff. Actually, they were planning just to drag our stuff and our system, our equipments, and even they start to whisper to us, why not to save your equipments and to send some of your equipments to the field hospitals? Actually, for me, there was a clear decision just to collapse the already remaining health system, and we're planning to have a parallel system. And even while we were able to give the staff $200, 800 shekels, which is almost $200, they start to pay for them $6,000. So you can imagine our staff, they start to tell them, I'll come to our field hospital and we'll give you $6,000, while we were unable to give them apart from $200. All the time we will face such decision. I'll tell you another example for such difficult decision at that time, which is the ambulance system. You know that some of the ambulance were used by the Israeli forces. And it's something so crucial, as the ambulance are able to move everywhere and no one can stop the ambulance system. Out of the blue, and after they start to arrest many of our staff in the ambulance system, and they start to attack the ambulance system out of the blue. For the first time, one of the organization, I never heard about that organization before, they came to tell us that we are able to move inside Gaza, and we can coordinate as international NGO with the Israeli side, and we can help you just to evacuate some of the cases from a place to another, even through the checkpoints of the Israeli side. At that time, you have to decide to allow them to move there while they are unknown for us, and even they can be used for any other reason, or you will refuse that, and some of the cases can be died while we're unable to evacuate them. The same of the field hospital, just to let the field hospital to be there, and there is clear decision just to collapse or to destroy the remaining of the health system, or not to give them a permission to do that, and then you can miss some of the cases. And so the answer was all the time, yes, but. Yes, but, and we're trying just to put some conditions and not to go for the negative part of the negative part of the story.